Hello, everybody, and welcome to the Zoom webinar. And it's great to be here and co-moderating with my hero, Yael. And just a few words, and she's going to introduce Yael. I'm going to introduce Yael. Yael is going to introduce Stanley and Ian. But just a little bit about this webinar, and also this is for Ian and Stanley. This series, I started this maybe 6 months ago, and just in the last 10 days, this is the fourth one in the last 10 or 12 days or so. And it started because I just wanted to get the community here in Greater Philadelphia together, but it kind of grew. And there's now an organization, not necessarily related to the webinars, but it's called Hope for Israel Alliance. And these are mostly Israelis, but also American Jews and people from all over the world, literally from Australia and from Switzerland and from England and from Canada and from everywhere. And the goal of this organization is just really simple: to support Israel in any way and every way that we can, and to fight anti-Semitism, and which is unfortunately very, very common in the United States and anywhere else in the world. So the one thing that I also wanted to mention about these webinars is that we have hosted, in the last 30 webinars, so we've been hosting a lot of different people from different organizations, leaders from Israel, from the United States, and it's on all the spectrum. And it's not necessarily organizations or people that we exactly agree or subscribe with or endorse the organizations. What it is, though, is we think that these are people who, we see different spectrum, different ways that people support Israel and fight anti-Semitism. And we think that the audience, the American Jews, the Israeli, the Europeans, anybody who's joining would be interested in being exposed to this different spectrum. So that's kind of like the mini introduction. Now, I wanted to introduce, my name is Yair, by the way. If I didn't introduce myself, I'm in Greater Philadelphia. I'm a physician. And I wanted to introduce Yael. I on purpose didn't have any formalities, but Yael is kind of my superhero. And I don't know how I think maybe she sleeps 1 hour a night to do what she's doing. She runs a busy New York, facial plastic surgery clinic. But as such, also with her background of Jewish and Argentinian and Israeli and American, she cares so much about the Jewish community and about Israel that she started like a WhatsApp group at the beginning of the war, and of physicians and healthcare professionals. It just grew and grew and grew to many hundreds. And then she decided that she wants to find an organization, and American Jewish Medical Association has been founded, and it's now becoming one of the biggest Jewish medical association. And she and Michelle and so many other people have been doing so much in terms of action, fighting anti-Semitism on small level, providers and healthcare, and going to the Congress in DC that she was just there, and arranging rallies and events. And she was in Philadelphia with Michelle a few weeks ago. And she's really been in the forefront of fighting, to support Israel and to fight anti-Semitism in the healthcare. So with that, Yael, toda rabba for co-moderating with me.
Oh, bevakasha, and thank you. And welcome to everybody who is live with us tonight and also on the recording. And it is very early on. I think so many of us who work in healthcare were really disappointed and kind of stunned by the lack of empathy for the victims of October 7th. And that was well before any other actions were taken by Israel or certainly any invasion of Gaza occurred. And when we started the organization, the American Jewish Medical Association, it really became clear that there were certain ideologies in this country that seemed to be leading or dominating in our medical schools, that seemed to be positioning Jews as the enemy and deserving of such treatment as we saw on October 7th. And early on, I met both Ian and Stan. I've never gotten to meet you personally. And a lot of your work informs about some of the ideologies that we're seeing in medical schools. And I'm personally very curious to hear from Stanley and Ian what some of the issues, maybe where they're stemming from. And I think a lot of the doctors and healthcare professionals, nursing, we're seeing it throughout the fields, have concerns about where we're seeing the anti-Semitism coming from now. So let me introduce both of you. It's Dr. Stanley Goldfarb is a experienced nephrologist and the former Associate Dean of Curriculum at the University of Pennsylvania's Perelman School of Medicine. Curriculum has been a topic that is really on everyone's minds right now, really pursuing some anti-Semitism curriculum is really seems to be lacking in K through 12 colleges and medical schools and nursing schools. And you've been relentlessly advocating for healthcare to be free from ideology, which is, I think, as we're seeing more and more calls from medical students, from nursing staff to disregard the Hippocratic Oath and use their medical skills to push their political agenda. That's actually a direct quote from a California medical student. I think your message is going to be timely tonight. Also tonight, we have Ian Kingsbury, who is the research director at Do No Harm and holds a PhD in education policy and has conducted extensive research on how ideological biases affect education and healthcare institutions. And both of you have been working tirelessly to promote transparency and accountability in policies and how they impact healthcare and patients alike. So thank you to both of you tonight. And I think my first question really, and I think question for everybody is, Stanley or Ian, tell us a little bit about what Do No Harm is and how did you get here? How did you get from being a nephrologist and an esteemed associate dean of curriculum and education at one of the most prestigious schools of medicine?
Yeah, so, it may take more than 75 minutes, but I'll try to compress it. But thank you so much. And I do admire what you and your organization have done. And, we first became aware of that, Ian and I, when we were on a trip to Israel with the UCLA group. And that was extraordinarily interesting and useful back in January. We had a chance to see the horrible devastation that was wrought upon the Jewish people and the Israelis at that time. So Do No Harm, I'll try to compress it. It started mostly because I sort of got pissed off about the way things were going in medical education. I became aware of this incredible trend towards sort of turning medical school into almost social work school. Now, obviously, they're still teaching about how to deliver some health care, but the idea that medical students need to learn about all the issues related to social justice and to fix things that are typically the province of social workers really started to bother me. I wrote an op-ed in the Wall Street Journal that was called "Take 2 Aspirins and Call Me by My Pronouns." It had nothing to do with gender issues, although we have been involved in some of that as it relates to children. But it sort of started me down the path of becoming an activist because I was sort of attacked so much for what I thought was a rather anodyne idea that medical curricula should focus on science and clinical science and should not be focused so much on social issues. And subsequently, we started the organization when it was clear that we needed to have some action about some of these issues. And I'll just mention that we've had a 3-pronged approach to our organization. And our mission is, as you said, is to get rid of identity politics, which I think anti-Semitism initially fell under, but there's clearly many, many more nefarious things going on by the evidence that on October 8th, they were all set to go to attack Jews and to attack Israel before, as you said, anything had occurred vis-a-vis any sort of offensive actions or defensive actions on the part of Israel to combat the terrible day of October 7th. So we started Do No Harm, and we had 3 aims. The first was just to inform the public, and we've had a lot of op-eds and TV appearances. I'm going to be on the Dr. Phil show, and part of it is going to be defending against anti-Semitism there as well. So we've done a lot of that. We've had over 10,000 media hits of some one sort or another. The second thing that we've done is to engage in legal activities, and we have right now we have 11 lawsuits going. None of them are directly related to anti-Semitism, but all of them are related to DEI issues. And we see that DEI, diversity, equity, inclusion, has really been the implementation path for critical race theory in education, which is basically explains, I think, in part, a lots of the anti-Semitism that goes on, because it's placed Jews in as another category, a category of oppressor. You know, we started out being, as Noah Tishby says, we started out being, for the Greeks, this other people, and then we became despised based on religious issues because of the killing of Christ. Then we became the object of hate because of the Black Plague, and then we became the object of hate because of, you know, the days of the Reformation, and then we became the object of hate on political grounds in Nazi Germany, and now we're the object of hate because we're successful and effective, and you know, so this is the ever-changing, as Tishby talks about, the ever-changing face of anti-Semitism. But we've engaged in a number of legal challenges to DEI, all kinds of DEI, because, you know, we think that the Jews are the canary in the mine, and anytime that there is this identity politics going on, I think Jews are going to suffer. Identity politics and DEI can't be, Jews can't be benefiting from that. That's been one of the false ideas, that DEI would help the Jewish students, for example, in schools. No, it's got to be eliminated, because it can't, this idea of oppressed and oppressors, and oppressed people can do no wrong and oppressors can do no right. And that's part of the ideology of what we're trying to deal with today. And the third part of our efforts have been in legislative areas. And right now, Congress has passed, or at least the House of Representatives has passed, a very expansive bill in the last few days that was sponsored by Representative Burgess Owens, that really seeks to get rid of DEI in higher education through various means, by altering the accreditation pathways, by withholding funds from schools that engage in DEI, that spend money on DEI consultants, and have demand you know, fealty to DEI principles in faculty hiring and promotion. This is passed in the House of Representatives. It's not just out there waiting for somebody to act on it. It's passed. It goes to the Senate. It's unlikely to be passed by the Senate, but it's an important moment. And we were very involved in helping to craft that legislation. We've crafted legislation throughout the states in the Midwest. I think there's something like 12 states that have passed bills of one sort or another about DEI, restricting it in one way or another, to the whole point of not funding state medical schools. And we focused on medical education, but it's extended to higher education as well. So that's sort of been the portfolio of Do No Harm. We have several plans in the coming months, because we also have what is known as a 501c4 organization, which allows us to do lobbying. And we're up to about 11,000 members now who are members of Do No Harm, and we're up to almost a $10 million budget each year. So this has given us lots of resources, and our membership has supplied us with lots of information. That's been the etiology of some of these lawsuits and legal actions that I've mentioned. So let me ask Ian to chime in, because Ian's been an incredible contributor and important support for all that we've done, and he really has done a fantastic job for us.
No, I mean,
Before Ian jumps in, I have a quick follow-up question that could be relevant to both of you, and just some background. The reason that I know Ian is through Yael, and Yael introduced me to Ian because we kind of needed his help. When did we need his help? In the area of Greater Philadelphia, there was a hospital, and Ian remembers this well. There was a hospital system, a healthcare system that has a DEI, and the DEI of that health system, or the major, you know, hospital of the health system, has a monthly newsletter. And in that newsletter, basically the first 2 pages were an article about how terrible Israel is and how the injustice written by pro-Palestinians. And that raised a huge, you know, controversy and anger in the community here, which is hugely, you know, there's a huge amount of Jewish people here. And they were so upset, and we were thinking about ways to deal with it. And Ian was helpful. But the question that I have for you is, you know, like you were talking about the anti-Semitism, how throughout history it has changed. And you're mentioning Noah Tishby. We interviewed recently, a couple months ago, Einat Wilf. And the way that she says it is, yes, the anti-Semitism is changing and morphing. Sometimes it's religion, sometimes it's politics, sometimes it's race. Now the new anti-Semitism is anti-Zionism. That's how everybody's jumping on the wagon. But the reason that I wanted to ask you before Ian jumps in is you mentioned the term DEI multiple times, Stanley. And it sounds like you don't really like it, or you don't think that it's appropriate for higher education, medical schools, etc. But you know, we just had here in our K to 12, literally in the last few days, an explosion that is related to, you know, to DEI. And one of the board members basically came and said, you know, and she is not white. She basically came and said, you know, all Jews are white, period. She kind of pushed for it again and again, and it was kind of unprovoked. But it goes along what you're basically saying, that the Jews are considered white. And according to the DEI, whites are oppressors. And that is very different than the oppressed, which could be black, you know, could be brown, could be Palestinians in this case. And that whole narrative of oppressed and oppressor is so wrong. But what many people disagree with you about is that DEI doesn't necessarily have to be. That's like one manifestation of DEI. But the original diversity, forget about the E, diversity of and inclusivity is actually not something that is so bad. You know, United States is a very diverse place. There's people coming from all over the world, different cultures, etc. And inclusivity, like building a ramp in a hospital for people who are, you know, in a wheelchair, is also something that is not so bad. So I just wanted to ask you, what do you mean when you say that DEI has to go?
Well, DEI is not only, I mean, the words are fine. I totally agree with you. Diversity is, we have a very diverse nation. Israel is a very diverse nation. There's nothing wrong with that. I think to elevate diversity to the goal, in our case, of medical education, of creating a healthcare workforce specifically for diversity, I think undermines the fact that medicine's job is to take care of patients, not to make sure that all of us have, or that Black people, any minorities have wonderful careers, or that Jews have wonderful careers. The job of creating a healthcare workforce is to make sure that we have an optimum care of patients. And that should be the only goal. Diversity may be fine in certain circumstances. I think kindergartners should be in a diverse environment. People in grade school should be in a diverse environment because they need to learn how to live in society. But the job of physicians, the job of medical school is not to do anything but care for sick members of society and not to change society itself. And medical students are in their 20s and they don't need to be diverse in order to learn how to live in the world. They're adults at this point. So diversity is fine, but in healthcare, using diversity as the goal for who should become a physician, which is where we are these days, we think is really a bad idea. And Ian and Jay Green did a wonderful study to show that the other argument, I mean, there are two arguments for diversity of physicians, of the healthcare workforce. One is a reparations argument. Blacks were definitely denied access to medical schools. Flexner famously closed down 5 out of the 7 Black medical schools in the early part of the 20th century. He did it because they were terrible schools, but nonetheless, Blacks didn't have much of a chance to become physicians. And of course, nowadays, there's no evidence that a talented and able Black individual who wants to go to medical school is going to have any trouble getting in. As a matter of fact, Mark Perry of our group has shown that Blacks, particularly African Americans that have MCATs and GPAs that are well below the average for medical school entry, have an 82% chance of getting into medical school. So even Blacks that are underperforming in college have a very high likelihood of getting accepted into medical school. So diversity in medical education is a problem. Diversity in pilot training school is a problem. There are certain fields that need to be spared because the public depends on these fields, and the object of these fields like medicine and bridge building and pilot school is to produce a product that benefits others and not a product that benefits the practitioners. So that's the diversity. In terms of equity, the problem with equity is that the meaning of it has become equal outcomes. And if you try to have equal outcomes, ultimately you're going to undermine a system because sometimes outcomes can't be equal. And if you say the only way we're going to achieve equality of outcomes is by harming one group of people to benefit another group of people, to make sure that there's some equity that you've identified and have decided is the right outcome for a situation, you're likely to produce winners and losers. And in medicine, again, our job is to take care of sick people, not to decide we're going to have winners and losers in healthcare. Our ethics say that when we have a rare treatment, for example, monoclonal antibodies during the COVID epidemic, that we're going to save them for the sickest people. We're not going to give it to people because of their skin color. That's what happened in 3 states during the COVID pandemic in order to achieve some theoretical equity, some theoretical equality of outcome between minority groups and majority groups. And finally, in terms of inclusion, Jews are being excluded. I mean, inclusion is fine if that's what it was, but it's inclusion only for certain people. It's inclusion for certain ideas. It's not inclusion, for example, if you have a conservative point of view. It's not inclusion if you believe that, in the case of these various schools, like the Ivy League schools, Jews are being excluded. So these terms are fine, but they need to be applied in the right time, in the right place. Diversity shouldn't be applied in producing a healthcare workforce. Equity shouldn't be applied by harming some people in order that other people have theoretically a better outcome. And inclusion should not mean that you exclude a whole bunch of people to include the people that you favor. So I'm all for those words as they are really defined in the dictionary. I'm not for those words as they've been defined by basically a progressive elite that's decided that they should mean something very different from their plain meaning.
Yeah, if I can just touch upon the anti-Semitism concerns specifically as it relates to DEI, the official name of North Korea is what? Is it the Democratic People's Republic of North Korea or the People's Democratic Republic? It turns out that North Korea is actually neither a republic nor democratic. So sometimes we have to look beyond the messaging and understand what these things actually are at their core. And with DEI, I think the idea that it stands for the tenets of particularly diversity or inclusion, at this point, there's just too much evidence to demonstrate that this is a falsehood. It's an ideology that clearly has Marxist roots. And when it comes to this issue of equity specifically, I think the thing that we have to be understanding of or realistic about is that includes obviously increasing the representation of groups that are so-called underrepresented in medicine, but there's a numerator and a denominator, right? So if we're serious about ensuring equal representation, that also means purging the people who are overrepresented, which would include, for example, Jews. And so when we went on that trip with UCLA, they told us, for example, that in their I think it's their class that started this year or last year, in their entire medical school class, they had 1 or 2 Jewish students, which for an elite institution in Southern California, I would say is basically impossible, if not for intent, right? Extremely suspicious. And so this question of why can't DEI just be inclusive of Jews? Well, it's not meant to be for that reason. The fact that they are well represented in these high status professions like medicine means it is not for us. And the fact that we see so many examples of this being the case at some point tells us something fundamental about what the nature of that thing is. We have a colleague at Do No Harm. Her name is Tabia Lee, and she was the director of DEI at a college in California. And she was fired in part because she tried to incorporate anti-Semitism into the DEI framework at that college. She was smeared as an accessory to white supremacy for doing that. So DEI can't be fixed and shouldn't be fixed. This is an insidious ideology that's remarkably dangerous to Jewish interests.
And let me see, just to put the exclamation point on this, Ian's colleague, Jay Green, and I was going to mention that Ian and Jay wrote this terrific report about whether Black patients benefit from Black doctors. Perhaps we can talk about that a little bit as we go on. But Jay has also done a study to look at the social media posts of DEI staff people around the country. And he found that overwhelmingly they had negative posts about Israel, and overwhelmingly they had positive posts about China, for example. So this is basically an anti-Semitic enterprise, the DEI enterprise itself. And that's another reason. Theoretically, it ought to make sense. It ought to be a great thing. It ought to benefit everyone. In reality, though, it's awful. And as Ian said, the words do not mean what they say they mean anymore, particularly when it comes to these views about DEI.
So the message that you're saying is it obviously is based on a deep look onto some of these DEI practices, but when overall when you come out and say I am against DEI, I can imagine, and I certainly know many people who would argue that racism truly is an issue in this country, and coming out and saying that you're against a policy that is trying to address racism and the health inequities that we see, that's a very challenging thing to be saying, particularly to people who have suffered, like the Black community has suffered because of the legacy of racism. So what are there are a couple of points to this is, there needs to be some addressment. There needs to be some support to be able to promote underrepresented minorities to drive them into healthcare. As a woman, I'm a big fan of pay equity, for instance. And we saw in many of the fields, and now it's actually so many women are in, but for a long time, historically, women were not encouraged to go into medicine. So how do we overcome some of the historical racism, prior, I would say, sexism that we found in medicine, without, how do you save the baby and get rid of the bathwater? That maybe there's problems in this ideology, but the spirit for many people is trying to get underrepresented minorities into healthcare.
Well, again, I have to disagree with you about the need to do this. I think, and what I tried to say a little earlier was, I think the job of medicine is not to create careers for anybody. The job of medicine is not to make sure there are Jews in medicine. The job of medicine is not to make sure there are Blacks in medicine or any particular group. The job of medicine is to take care of sick people. And the way to do that is with the most qualified, the most capable individuals. Now, in the past, Black individuals who were really qualified and really able were denied opportunity. That is no longer true. There is no qualified Black individual who's applied to medical school in the last 20 years who hasn't been accepted, period. So in my view, diversity issues and the idea to have a diverse workforce is one that is not, should not be a goal of medicine. And that if we want, what we want to make sure is that there's opportunity that's available for everyone, and opportunity is equal. Someone's called the current crop of DEI advocates civil rights reenactors, because what they're talking about is a situation that for the most part has been remedied in this country. There's no question that there are problems in the Black community. The problems then really, they need to be addressed directly. There's a problem of Black kids don't go to school in the inner city. They don't show up. There's tremendous absenteeism. If they don't have an education, they're never going to get ahead. It doesn't matter how many programs you throw at them. So my view is that what we really need is a society that gives people that are capable and working hard have the opportunity, and that opportunity should be unrelated to how they look or any immutable characteristics that they have. And I think medicine needs to be spared from this diversity push, because our job is to take care of sick people, not to provide good careers for individuals.
And, I think your question, Yael, it also gets back to this point about not accepting the words DEI at face value. I'm very skeptical of this idea, actually, that it's some sort of bulwark against anti-Black racism. You know, we see that it almost always entails different standards for different demographics of people. And there's common sense and a vast literature that says when you have different standards, it tends to create stigma against those who are privileged by that lower standard. And, you know, Sol and others have commented on this too. Unfortunately, if we have different standards for groups underrepresented in medicine, I think actually that's going to be very counterproductive to the cause of fighting racism, wherever we imagine that might exist. Beyond that, unfortunately, DEI tends to enforce certain orthodoxies that are remarkably bad for Black people. One of the most salient ones is there's this idea that race is a social construct alone with no connection to biology whatsoever. And the reality is, as you know, race is a social construct, but with some genetic correlation there. And so there was an article, for example, in the New England Journal of Medicine a few months ago. I wrote about this in City Journal, claiming that the higher incidence of preeclampsia among Black women must be because of racism. Because if race is a social construct, then there couldn't be any sort of biological explanation. So it must be racism. It turns out there is a well-known biological connection to a risk variant in a gene called APOL1 or something. And so, unfortunately, some of the orthodoxies that we see in DEI leads to remarkably bad thinking and policy for all kinds of groups. It's not, you know, the ways in which it's destructive is not exclusive to Jews.
Very interesting. So Stanley and Ian, there's actually a couple of questions from Eve and Robert that continue the discussion if DEI is needed or not. But before that, I promised one of the attendees who actually texted me on WhatsApp, Ron Waxberg from New Jersey, and I'm just gonna mention what he asked me to ask the two of you. So Ron has been following Stanley's work, but there's one aspect that he still doesn't understand. Stanley explains how the DI categorizes Jews as white people and therefore oppressors, kind of as we spoke before. However, that doesn't explain why we, the Jews, are treated so much worse than the other white people, the non-Jews white people these days. So maybe you can explain and address this issue.
No, and there's no question. There's vile anti-Semitism. I mean, there are just bad things in the world. So I do think that, and I'm willing to be, I guess, charitable to a lot of the young people that are in the streets screaming and yelling about Israel and about Gaza and about the circumstances there. I'm willing to be charitable and say that many of them really have bought into the oppressor-oppressed diet, and whenever they see it, particularly when it's organized and makes it easy for them to express themselves, that really is their impulse. It's not because they hate Jews. But then there are a lot of people that just hate Jews. And I think, again, the fact that on October 8th, there was such an organized outpouring, I think speaks to the fact that this is a long simmering hate that, you know, just is one of the real illnesses of society, our society and other societies over the centuries, that unfortunately, you know, is a reality and has to be dealt with. And the only way to deal with it is to fight back against it. And, you know, thank God there is a country now, and that has an army, and that can be the defense against Jews and to maintain, you know, sort of a spiritual and in some cases a physical base for Jewish people. And so I think that's part of the problem here. But there's no doubt that this philosophical idea of the oppressor-oppressed dyad has provided, you know, a rationale for some people to approach this and allows them to think, well, they're not really being anti-Semitic. They're just acting against a government whose policies they think they understand. They really don't understand, obviously, but that's the basis for their actions and their words. But there's also just a lot of bad people that hate Jews, And, unfortunately, that's what we have to deal with.
But Yair, to the question of why Jews specifically, if it's the white people who are oppressors, why does it appear that there's a special disdain for the Jews? And I think there's a couple factors here. One is that critical theory, the way it's applied in the United States at least, very clearly links race and power, right? And so we just saw this the other day, actually, where Ta-Nehisi Coates talks, has this scathing criticism of Israel. And I think once again, unfortunately, it's basically imposing a US racialized paradigm onto Jews and onto Israel. Imagine that there's some white oppressor and brown oppressed. But because of this connection between status and power, again, as I mentioned, Jews, fortunately, at least historically, we tend to be well represented in these high status fields like medicine or law. And so according to this paradigm, in some ways that makes them the whitest of the whites, right? They have all kinds of power and privilege, it appears, to these people. Beyond that, why the special disdain for the Jews? I think part of it is also that it's easier. We are a small minority, and we're kind of easy to pick on for that reason. If you were to go after white people generally, there's enough of them that it makes it much harder. So I think it's that minority status in addition to those privileges that make them a particular target.
So speaking of Jews being a target, and we've seen this, and I think you guys are aware of this example as well, is Jews are already a target. And here we have what is, great words: diversity, equity, inclusion. And for Jews to be carrying the flag saying, no, we want to get rid of diversity, equity, and inclusion, has often been said, you're setting yourselves up to be a target of ever more hatred, because now you're going to have people who have been underrepresented in medicine for so long, and now you're saying you want to eliminate the programs that are fostering and supporting them in the fields. And indeed, we've seen this. I mean, early on, we saw there was a very large issue and controversy in one of the Dermatologic Society meetings, and literally a well-spoken, intelligent dermatologist who's a member of an underrepresented minority made this comment, which I thought was incredibly hurtful, and it will be to everybody listening to this. Oh, that term, Am Yisrael Chai? That's what they shout before they come to lynch us. That's exactly what we want to avoid. If anything, during this time period, we want to have allyship. We historically, Jews have always reached, are tremendous fans and have been on the cutting edge of making sure we had diversity, equity, and inclusion for not only ourselves, but for our many other underrepresented minorities in this country. So how does one step forward? I would posit that there must be one really good heck of an alternative if you're standing out there saying I'm going to get rid of it.
There's a whole school of Black intellectuals who totally agree with the position that do no harm has. The Coleman Hugheses of the world, the Glenn Lowrys of the world, the Thomas Salles of the world. They're the Black community. The Black intellectuals feel very strongly that they don't need this leg up, that they should be able to succeed on their own, and they can succeed on their own. And so this idea that this is a group that endlessly needs this support, I think is just really has become something that's benefited a group of elite individuals who have now populate DEI offices. And I'm not sure it represents the entire Black community. For example, we did a survey of, I think it was 900 adult Black individuals, and asked them, would you rather have a doctor that looked like you, or would you rather have the best qualified doctor? And 85% of them said they'd rather have the best qualified doctor. And when studies have been done asking Black individuals, showing pictures, which kind of doctor would you like to go to? This was included in the famous Oakland study. They didn't care. They wanted the best care. So we've imposed on them some idea that they need this endless support and this endless sort of inequity to achieve something on their part that I think represents, some sort of guilt notion on our part, which doesn't really represent reality. And I think, this has been gone. The Supreme Court said, it ought to go on for about 25 years, this affirmative action, and that should do it. Well, here we are 25 years later, and, we're told by Ibram Kendi that discrimination should go on forever. I mean, that's really his idea. And that's the idea of a group of people that have benefited greatly from the diversity, equity, and inclusion regimen. So I just I reject it. I think that Black people are quite capable of being wonderful physicians and being extremely successful individuals, and they just need to go ahead and do it.
I agree with Stan. I don't think this is a consensus issue in the Black community or in any community for that matter. Beyond that, Seth Mandel from commentary recently has critiqued mainstream Jewish organizations like the ADL, which he thinks or observes correctly that they seemed, at least before October 7th, to have sort of this end of history worldview, where we, the Jews in the United States, we're going to enjoy a position of permanent safety. And so we don't really even have to necessarily worry about or safeguard our interests. And we can just be out there fighting for the interests or the protections of other groups. And that's a remarkably noble idea, and I wish it was true. But as October 7th revealed, obviously that's not true, and we do have problems here. And so we have to think very carefully about who our allies are, because as I said, we are a small minority group, but we need powerful allies. And by just about any measure, our best allies and supporters are people generally on the political spectrum who exist on the center right. And so, we maybe there does need to be a mindset shift in the Jewish community where, of course, anytime that we see discrimination, we're going to speak out loudly against it. And we're going to be agents for progress and responsible change. But understanding, again, that our best allies, it would appear to me, exist on the center right of the political spectrum.
So I want to build on what Yael's comment or question was, and basically merge two questions from Eve and Robert. And, when I think about it, even what I hear in this conversation, we hear a lot the word Jews, and we hear a lot the word Black. It's almost like Black versus Jews. And that is my sense, like I was telling you, in our school district here, we had an issue with the board member, all of that. It almost became, or people are really afraid that it will become kind of like a little war or disagreement, but on a bigger scale between the Jewish minority and the Black minority. So Eve, for example, is asking the following. She says, well, there's many studies that show that actually diversity in healthcare providers is important and it does improve outcome. For example, and again, I'm reading what she says is Black patients have better outcomes if the physician is Black. And maybe instead of just aborting DEI, and which will look very bad for the Jews, we should just create a mechanism that DEI, by definition, will include Jews and the IRA definition of anti-Semitism, etc. And then I'll also merge the question of Robert, who says that he appreciates with many of your comments, but are we losing possible alliances and allies going after the DEI as part of our fight against anti-Semitism or to support Israel? Should we not focus on making ourselves part of the DEI movement, kind of like what Eve is saying? Just be part of the, insert the Jews, the anti-Semitism, that we are a minority, that we are oppressed. I mean, we know when we are oppressed. My grandmother was still alive, and I keep on saying it, but I don't care. She's still alive, and I talked to her, and she's blue eyes, blonde. She's, she lost everybody in Auschwitz. She stood in front of, talking about doctors, she stood in front of Dr. Mengele, who kicked her to the side in order to save her. He didn't want to do it intentionally, but he sent all the, her mother was bad, in poor shape, and her sister to the gas chambers. And she was oppressed also. My grandmother and all the white people are oppressed. So why can't we just be part of the DEI as well?
So let me just first ask Ian to comment on this canard that Black people have better healthcare outcomes if they have Black doctors. Ian, all
Sure.
yours.
Yeah. Thanks, Stan. So this is a widespread idea across the healthcare establishment. You see it plugged ad nauseum by, for example, the AAMC, by prominent researchers. So a few months ago, Jay Green, who's a senior fellow at Do No Harm, and me actually looked what the research says about this issue of, it's usually referred to, of racial concordance. So do especially Black patients receive better care from Black doctors? And so it turns out, first of all, that there's a cherry picking problem. They would point to one or two studies and ignore the fact that there was actually a much larger body of evidence claiming that no such phenomenon exists. It doesn't matter, who is attached to who. They receive the same quality of care. So number one, first of all, cherry picking. And sorry, actually, also on that point, there are 5 what are called systematic reviews about race concordance in medicine. And so the idea is to avoid this cherry picking, you make sense of what the evidence says collectively. And 4 of those 5 systematic reviews conclude there's no benefit to racial concordance. And as we critique in the report, the 5th one that said maybe there's something there has some major methodological problems. And then in terms of these couple of studies that claim that Black patients receive better care from Black doctors, well, one of the most prominent ones, in fact, it was cited by Justice Brown Jackson in her dissent against Students for Fair Admissions, is a study that claims that Black newborns are more likely to survive if assigned to Black doctors. And we wrote about our reasons to be skeptical of that conclusion in our report. Well, I think it was just last week, actually, the journal that published that original study published a critique or a correction. There were other researchers who got their hands on the data and showed basically it was not a proper conclusion. They made what appeared to be intentional methodological errors en route to that finding. And so between what the sum of the evidence actually says and the issues that we see with the contradictory evidence, those couple pieces that say maybe there's something there, I think we can safely put to bed this idea that patients of one race receive better care of physicians from that race. It's just not true.
It's just not only is it just not true, but in fact, there are no data to show that there is any long-term healthcare benefits for the racial concordance. What's mostly been looked at is how good the communication is between patients and their physicians. And as Ian said, it turns out in one study, there was I think there were 12 papers that showed, or 12 parts of the study showed that there was a benefit. 8 showed that communication was actually worse between the Black patients and the Black doctors, and 80 other kinds of assessments showed that it made no difference. So it's easy to say, oh, of course, Black patients are going to have a better healthcare outcome if they have Black doctors. But then when you think about it, is why should there be? What would you expect to be the mechanism of that? Are Black doctors better than white doctors? And also, if that's true, should white patients only have white doctors? Is that what you're asking for? Because if it's better for Black patients to be with their kind, so to speak, isn't it better for Latino patients to be with Latino doctors and Asian patients to be with Asian doctors? So what you're really calling for here is a racialization of American society. And that's what we're against. We are for a colorblind society, and that's what we believe in, and that's what we should strive for. And I don't think we should be sort of figuring out what we can do to undermine reality in order to gain allies. That shouldn't be it. What we need to do is convince our allies of what makes sense and what's reality. And that's what we have to do. And that requires a long marathon-like struggle that I expect we're going to be involved in for many years to come. I would point to Yascha Mounk's book, The Identity Trap, which is a wonderful book. He's a man of the left, a professor of political science at Johns Hopkins, very well-known scholar. And he wrote this book, The Identity Trap, pointing out the dangers of these kinds of attempts at slicing and dicing people based on their identities. And his conclusion is, this isn't going away. We're going to be fighting this issue for many, many decades to come. So I think our goal shouldn't be, how are we going to make Black people think we're really their allies? No, we should make Black people understand we are their allies, because we're interested in the best outcomes for them, and we're not interested in playing a race game.
So since October 7th, I'm curious if before October 7th you were already noticing, because we really got to meet after everything kind of blew up. Before October 7th, were you seeing anti-Semitism in the curriculum? Were you seeing anti-Semitism in medicine? Or this seems really to have exploded then and has shifted and driven some of the focus of what you guys have been working on?
I was unaware of anti-Semitism. A lot of my colleagues were Jewish. And no one ever spoke about Israel. It really wasn't an issue. It turns out it was bubbling up in certain segments of the academic world, for sure. But it really hadn't been anything that anybody spoke about it. And then all of a sudden, it was like somebody switched the light switch on and turned the light on and said, oops, here we are. This is what's really going on. This is what's really in people's minds. So maybe it was naivete on our part, on my part. Of course, I was out of being the associate dean for curriculum by the time that happened. So I can't say that there weren't stirrings of this right before it, but I think this was as shocking to me as it was to most of sentient human beings. This terrible impulse that was just lying in wait. I do think, though, that it clearly has been organized. I think the idea that this is a spontaneous upwelling of ideas of individuals who just saw the light all of a sudden without anybody being the tinder behind all this is obviously a wrong notion. This is organized, this is well-funded, and I think this represents another attempt to undermine Western society. It isn't just about the Jews. This is about American society. It's about Western civilization. It's not just about the Jews. The Jews are, the first ones to get the hate, but it's not going to end there. That's for sure.
If we could circle back to part 2 of Yair's question from a few minutes ago. Why not just incorporate Jews into the DEI framework? Just because I think this is an important point. First of all, it's the factor that I alluded to, that DEI is not for us because of the representation issue. Okay, this is fundamentally about increasing the representation of certain groups, decreasing the representation of certain groups. So it's unfixable. But beyond that, this idea that the anti-Semitism that we're seeing could be meaningfully addressed through incorporating anti-Semitism into a DEI framework. Even just taking that thought on its merits, if you don't take my word for it, you should Google search. But if you look at studies on the efficacy of DEI as it relates to behavior and attitudes, there's really no indication whatsoever that this is effective programming. It doesn't make people behave differently. It doesn't make them permanently change their minds. If anything, there's some indication that it makes people resentful. So, for as grave as, we see the threat of anti-Semitism in the United States today, I'm very skeptical of the idea that DEI is the solution for fixing it.
So there's a few more questions from the chat, but I want to ask another question and I don't know if you're going to be able to answer this because it's not so much about DEI anymore. I want to move to something a little bit different. It's more about anti-Semitism in healthcare. And a couple of months ago, I actually hosted, Yael was the panelist with Michelle, and I want to bounce a case that still haunts us here in Philadelphia, but is unfortunately very common all over the United States, maybe the world. And when you see things like related to anti-Semitism in healthcare, sometimes once in a while, you see a provider. So in a case of the area of Philadelphia, in one of the major hospitals, a nurse practitioner that is supposed to triage women, OBGYN, that pretty much every moment of her free time, she goes on Facebook and she says the most, horrendous things that you can imagine about Israel. and how the IDF are rapists who rape the Palestinians and murderers and like, unbelievable things. And despite multiple comments to, or people, including physicians and patients, reaching out to her bosses or HR, there was nothing done except the fact that she had to say on Facebook, these are only my opinions and do not represent my employer's opinions. But she keeps on hating so much. And the concern of so many people is what's going to happen when she's going to go to a woman by the last name of Goldfarb or Levine. My wife is Levine. And, will she really give them, we're talking about adequate, and impartial care. Will she really give impartial care to somebody when she hates so much the Jews and the Israelis? How do we deal with it? How do physicians deal with it? How do patients deal with this?
I have sort of two thoughts about it. The first thought is, here are the Israeli surgeons operating on the Hamas terrorists that came into the Gaza envelope and wrecked all the horrible actions that they did upon the communities there. So part of it is, physicians have to rise above it, and they're expected to rise above it. The other side is employers don't have to put up with this. They do not have to put up with this. They can have rules of conduct that they expect from their employees, and if they're private institutions, they have a right to have their standards, just like these universities have a right to say, no, you can't go ahead and scream from the river to the sea, and that this is unacceptable behavior. And if a faculty member does that, we can fire them, just like Amy Wax was fired for her opinions, or not fired, but suspended and sanctioned in all sorts of ways. So they ought to have their standards. This nonsense that there's nothing they can do about it because HR tells them they can't do is nonsense. There's a time for organizations to stand up and say, we're not going to stand for this. Now, if somebody who's pro-Israel writes, I'm really against Hamas terrorists, that's not the same as saying I hate, Muslims and I hate Palestinians and they're awful human beings when you argue against terrorism. But they're not arguing against, the Israeli government. They're arguing against Jews in this sort of commentary, and that's different, and that should not be acceptable. And the organizations need to man up, if you will, and do the right thing, and prevent their employees from having these kinds of Facebook posts and having these attitudes. These attitudes are incompatible with really providing optimal health care. I mean, that's the reality of it.
That's right. I mean, I'm a big fan of free speech, right? But there's a common refrain, and it's correct, that freedom of speech is not freedom of consequences. And as Stan alludes to, these hospitals and these organizations are well within their rights to enforce certain norms and values that rejects the idea that you can say such despicable things about a group of people, or as unfortunately we see the case sometimes of promoting or glorifying terrorism. So we should expect our hospitals and healthcare systems to uphold that standard, and it's perfectly normal and reasonable to make some noise when you don't see that standard upheld. Just yesterday, Rupa Maria, who's a professor and clinician at UCSF, was finally suspended after months of just horrific comments. Where finally she said, how could people possibly feel safe even being in the presence of an Israeli physician? But it took, months and months, and I think we should expect better of our universities and our hospitals. It's just unacceptable.
What do you think are some of the best actions forward to combat the anti-Semitism that we're seeing? What are some of the best moves that you've seen? And particularly, like with Rupa, by the way, she's suspended, but she's suspended with pay. So
ridiculous.
So what do you, because exactly as you're saying, there is a lack of enforcement for policies, and that's one of my most favorite phrases is freedom. Can be freedom of speech, but doesn't mean freedom from consequences. And also we have academic freedom. Academic freedom actually has professional standards. and it's the lack of desire to uphold those professional standards, or also, as Stanley's saying, the professional standards seem to have changed. I mean, if at UCSF, the professional standard is, doxing colleagues and hateful rhetoric, well, that apparently is the new professional standard. So what do you think as the best, and where are we in pursuing that? And do you see the tide changing?
I think there are two things. One, obviously, you cannot easily change people's hearts. Let's put that aside. But what we can do is really combat this organizational anti-Semitism, I'll call it. So, for example, we're pushing to introduce legislation that will say that any student group that supports any terrorist organization could not be given any support by a university. The university could forfeit their federal support if they went down that path. Getting rid of that kind of support would be very helpful. We think getting rid of the DEI offices will help this, because it'll reduce this idea that identity politics are holding sway over universities. I think we need to push the government to attack these issues in all ways that are legal and fall under the Constitution. And again, free speech, it's not a suicide pact, and our government needs to understand that. So those are the kinds of things I think that need to be done in terms of changing people's hearts and minds. One of the real difficulties that we have in our country right now is we don't have a free press. If we had a free press, we would have a much more balanced reporting of what Israel is like, what the nature of these struggles are like, what the historical basis for these struggles has been, and then we probably would have a very different kind of narrative that was out there. But it's pretty hard to read the newspapers, the front page of any newspaper, and not get the sense that the Israelis are a bunch of lunatics who are truly genocidal and are trying to kill all the Arabs. Statements that fly completely in the face of the reality of what life in Israel is like, both for the Arab Israelis and as well as for what Israel is looking for as a nation. So I think those are the things we need to push back against. We need to talk to our politicians. We need to make noise. We need to fight. We need not to be quiet. We need not to figure out how to sort of get along. We need to show how we really need to triumph. And it's going to be a long struggle, and we just need to pursue it.
I think alongside combating those ideologies, we've also got to direct more attention and focus to the pipelines into medicine. So there's a phenomenon right now, and I think anyone probably who works in a university setting or a university hospital setting can see this, where it's pretty obvious that medical schools are screening just as much by political ideology as they are by merit. They want the activists. They, as Stan alluded to earlier, they see doctors as healers, yes, but also social activists. And so this brings in a lot of people with truthfully radical views about Jews and about Israel. By restoring that to a focus on merit, we're going to get fewer of these people with kind of extreme and crazy ideas. The other thing, and this is not something, at least, for now, that we take on an organization, but Jay Green, whose name has been mentioned a couple times, he wrote about this recently in Tablet, where there's a lot of folks coming into medicine from foreign countries, in part because there are a lot of residencies that need to be staffed. The number exceeds the number of folks graduating from medical school. And so we have a lot of doctors who were trained in countries, unfortunately, where Jew hatred is, entirely normal and institutionalized. And we've seen this on the college campuses as well, right? Where those chanting globalize the Intifada, some of them are Americans, regrettably, but a good number of them are not. And they come from countries where those kinds of values are normal. And so I think, trying to get more American doctors into American healthcare would probably be a good idea.
I want to take going back to the DEI, and we have only less than 10 minutes. So I do want to take a couple of questions from the attendees, and I'll merge two questions from Irene and Robert. So Irene is basically saying, okay, let's say that you're right. You convinced us that we should maybe, consider doing something else instead of DEI. But she says that in some locations, like in California or other places, it will technically or realistically be impossible to disassemble DEI. So should we do something instead, such as get strong Jewish representation within the DEI structure? And then the second question of Robert, which is kind of aligned a little bit, similar a little bit, is that, okay, let's say that we agree that DEI should be disassembled. In the medical school, and I know this, I teach a lot of residents and students from different backgrounds. The problem is that in his medical school, if he says that he disagrees with DEI, he will be labeled by so many people and the word will be spread that he is a racist, perhaps. And, even though he agrees fighting it, what is the approaches that will not cause this clashes, adversarial relationships that, puts us behind the 8 ball?
Yeah, I mean, those are the million-dollar questions, aren't they? I would first say that, I've told students this. I've said, really, if you're going to speak out, be very careful. And probably I argue against them speaking out as students because it'll hurt their careers. But then again, you run into students that really have guts and say, look, I don't want to put up with something that I really feel is wrong and I disagree with. So courage is a little bit of a part of it. And I know it's easy for me. I'm past the time when I have to worry about, supporting my family. I'm retired and all that. So it's easy for me to say, and I understand that. But the truth is, if you're going to make change, people have to step up and show the courage of it. And if they're going to call you a racist, well, you find out who your friends are, and you find out that you have new friends after you go ahead and speak truth to power, if you will. And as far as California and other places go, again, we're working really hard to look at the accrediting agencies, the requirements that they put in medical school, the kind of freedom of speech that's available. There are legislative potential remedies here because these schools depend on federal funding. Every one of them takes huge amounts of money from the NIH. They take huge amounts of money from other federal agencies. They very much depend on the federal government, and the possibility of legislative change that can influence their funding, I think, could produce changes. And I do believe if we got rid of DEI offices, this whole thing would become a much less prominent problem. It won't go away, but we wouldn't have this organizational activity that really ends up being basically an anti-Semitic force that's going on in universities.
I don't even have much to add. I mean, it's just perfectly said. The only thing is, I have to say truthfully, I've been a little alarmed sometimes by the absence of courage in the Jewish community. I guess part of it is that I think in most of our lifetimes things have been quite good, and so we're not in the habit of really going out and forcefully fighting for our interests. And so I see a recurrent pattern where there's many Jewish physicians or Jews in general who see the problems with DEI, but they rationalize the way to stay silent on it. I have friends who wouldn't like this, or there could be professional consequences. But if you agree that things are bad, this, unfortunately, this is going to require a little bit of uncomfortability. So we've got to try to be a little bit more courageous about this.
As we've been seeing, there have been states that have eliminated their DEI offices. But instead of being called DEI, which, now is capital letter DEI, versus little DEI offices, I mean, they just have different names: OEO, OEI, OIE. I actually don't even know what these acronyms are standing for. So isn't it just a horse by a different name?
Well, there are parameters that one can measure. For example, the composition of medical schools, the student composition. If that doesn't change, then they're now undermining the Supreme Court ruling about that was for students for fair admissions versus UNC and Harvard. And they're going to get sued. and this is going to be a court fight about this. And really the initial observations are that, the changes that were anticipated are not occurring. If you just went based on merit in those schools, and we're going to see the same thing in medical schools, they're going to be investigated for their lack of adherence to the Supreme Court ruling, which is now the law, and they're going to have to suffer the consequences. So yeah, I agree. That's the game they're trying to play. So it's a little bit of a whack-a-mole situation, but a few lawsuits are going to really put the chill into that sort of activity, and lawsuits are coming.
I agree. And I mean, look, the other thing is I think disbanding them, even if they reemerge as some other alphabet soup organization, disbanding them formally, at least very obviously, puts them on notice. And so I don't think it's a meaningless victory, but we'll put them on the back foot, and then where necessary, solve it through litigation. So you're right that disbanding it formally is probably more the beginning of the fight than the end, but it doesn't mean that we have to be resigned to failure.
So I promise you that we're going to be, hard stop at 9:15 as out of respect to all of you and the attendees. But I do have one question to Yael, actually, not to Stanley and Ian, because the way that I see it, I do think that Yael is one of the most courageous people, and the Jewish leaders was fighting what is happening, all the anti-Semitism in healthcare. And I've known her for a few months, but I've been following what she does. And, it's unbelievable to think about it, that we're almost at 1 year after October 7th, and we have brothers and sisters who are still underground in the worst conditions, a whole year. And I want to ask Yael, based on all your work and all the organizations that you're working with in California, Florida, all of that, how do you feel? Do you feel optimistic that the Jewish community is fighting back and we are going to deal with this and beat this?
I think the one thing for all of us Jews is that we have this perennial optimism that pushes us forward. And I think Ian and Stanley embody this, as though you may not complete the work, you cannot desist from it. I mean, it's perkei avot. When we look, and the fear that we all have is that we're in the Weimar Republic, and the most progressive liberal societies, and we're leading down into the path of the absolute worst of dehumanization based on identity politics. The difference then versus now is exactly, what Ian and Stanley have been saying, the importance of legal work and legislation. And then the other difference that we have is unity, is that we can have only by really having tremendous unity. And I think that's all of these organizations are finding each other and finding the voice and being courageous and not losing our moral centers when we do this fight, and not losing the importance of what we're doing this for. And we're doing this for all of humanity. And I would be hopeful because I compare this to a virus. And just as we have almost eradicated smallpox and very much controlled polio, this is the world's oldest hate, and we need to understand this viral hate that's going on. And who better than us to understand it and to eradicate it and control it in the same way? And it's this fear of other, identity politics, however you want to call it. So yes, I want all of us to be hopeful, but we are living in dangerous times, and man is fraught with polarization, and that is just the human condition. And we are what, as Judaism teaches us, we are what we do, and we need to walk the center path.
You have to remember the Winston Churchill, this famous statement about the American people. He says, the American people will do the right thing after they've tried every other alternative. And I think the American people will do the right thing at the end of this. Now, the rest of the world is another problem, but I think the American people will do the right thing.
Well, it's good to finish on this optimistic note. And I wanted to thank all of you. Stanley, thank you very much for joining us. Ian, And of course, Yael, we could have continued this conversation easily for another hour, and maybe in the future we'll have another of these sessions if you'll be okay with it, and if there be, and I'm sure there will be interest. So thank you again for all the hard work and everything that you're doing to fight anti-Semitism in healthcare and everywhere else. And yeah, we'll be in touch. And toda rabba and laila tov to all of you.
Thank you.
It was a pleasure. Thank you.
Toda.
Thank you.